Good afternoon, everyone. Again, my name is Jacqueline Franklin, and I could sum this up real quick and say all that you've heard today. If you do it correctly, I won't end up at your door. I've been dealing with Medicaid, like I said, for about 21 years, even though I don't look it, but I love my job. I love also being here in a place to where we come to where you fellowship and learn about how to do it correctly, and you have a chance to ask questions and inquire about the right way to do something. I think education is the best tool, and I thank you for including me and inviting my office to participate, because we do work jointly with HHS, FBI, in prosecuting cases of only Medicaid here in the district, although it might reach into Virginia or Maryland. But what we do is we don't go after people just to be going after them. Meaning, as Nick said, somebody's referred it in, somebody from the single state agency has looked at the data and determined that a flag went up, somebody's called because they read an EOB, an explanation of benefits that says, I didn't get this service on this day, or I did get a service, but the one that was billed is not the one I received. Or we have a hotline, which let me say that outside on the table you will find some brochures that include our hotline number. But our referrals come in so many different ways that there's no telling. It might even be staff in the office that calls and says, this is what's going on. And it's not every time that you get a call that something is fraudulently wrong or criminally wrong. It could be innocence. And that's where it's like you have all these tools in front of you to help you educate yourself on how to do things correctly. And one of the things is that I've taken since I've been here listening this morning is that everything is right there in front of you. If you are the person signing up to provide the service with the District of Columbia's Medicaid program, look at it like it's your responsibility to make sure your house is in order. Your staff needs to be educated. If you're going to be billing for certain codes and procedures, you ought to know which codes and procedures you can bill for. However, I've heard about the self-disclosure. It occurs, I'm sure, but I just hadn't seen it yet. I'm sure it happens. I'm sure it does because you have all these branches here. So some people have seen it. I'm just saying I have not. Because by the time I show up, it's not a mistake. It's not an error. When I see repeated claim forms that show the same thing over, and over, I don't consider that an error. Maybe you were misinformed, but it's your responsibility as the provider. It's your duty to make sure that everything that you're submitting for reimbursement was submitted correctly. It's as they've said by the panel, claims are always good at face value. It's easy to get a good claim through the system. It's when you go back and you do the audits, and you go back and you do the checks, you go back and you look at those records that don't add up. It's as, I forget the doctor's name, who said, when you document into your files, make sure you document correctly. Because if it's not written, it did not happen. You verbally telling me, oh yeah, I did that won't pan out. Because you're supposed to be able to defend everything you've done. And I would also like to include the part about the repercussions as a provider. Anytime, I don't care if it's a doctor, DME, whatever your specialty is, anytime you do something, and I'm speaking just for Medicaid, but anytime you do something regarding a recipient, you're creating a history for that person. So therefore, if you're doing something to save, for an example, a doctor who says he's treated someone for mental illness and they came and they did an hour's worth of a visit. But now you've created a history diagnosis for this person, and if you're only doing it to fabricate the claim and get more dollars, you've now affected this person's history. I don't think it's fair that in good faith somebody's coming to you and then you're doing something to benefit yourself. Not saying that's what's happening, but that's how a claim can go through, be processed, it'd be good, but the ramifications go further than you just submitting a claim and getting reimbursed. My office is located here in the district, and we're about 21 staffed up, and I think we have like 2 more coming aboard, another investigator. And what we do is prosecute healthcare fraud criminally. We also, if we can't get you criminally, we do look at civil, and we do the CMPs. But we also, as I'm here today, educate. I think that's the one thing that helps everyone, because everybody is about being proactive, and to educate is about that. I like the idea that we all go out and we entertain and we intermingle, and healthcare fraud does not cease. I'm on more task force than you can imagine, because new things always come about. People are thinking of ways to get over that you wouldn't imagine, and I don't know, maybe you're aware about, let's say, I'm gonna call them medical games, where groups come in, they bill, then they get out. They might ship the money to some other country, some other place, but they find a way to get the money, then run. But then here we come. We're after the fact. But as Dr. Budetti, he stated, there's so many things now we're doing to be proactive, to prevent things happening before they can begin. And I think in my journey as an investigator and being part of Medicaid, I've seen things where now we're at the point of where it's like we're finally getting a grasp on it, but we're always a step behind. But there's tools, and there's seminars, and there's education. And I welcome the fact that there are so many people who want to be providers. And we're talking about trends. DMEs are one of the trends we see now, because you have providers, for an example, have a case I'm looking at. The provider has a DME number to do durable medical equipment, but they also have a pharmacy number to provide prescriptions. Why would a prescription ever be filed under a DME number? But it's so simple to get through. So therefore, that's something that will come to my door. There's something when I show up at that pharmacist, they're gonna have to explain why that did occur. Other trends could be home health aides. There's a disconnect between showing up and working for 8 hours, signing a piece of paper saying you work for 8 hours, and actually working 8 hours. Because we found that some people, like you say, they have that dual thing going. I work over here and I also work over here. How you do that, I do not know, but somebody owes us back. And when it comes to validating your employees, your staffing, making sure they don't have a criminal history, making sure their licenses are valid and current. And I'm in agreement that when you first hire somebody, most of the time that's what happens. You check it and you say, okay, he's clean, they have no record, but you might want to follow that up. It would behoove you to keep abreast of what's going on, what your employees are doing, because again, it comes back, it's your responsibility. It's your job to make sure you're facilitating the best office you have or doing the best service that you can. But then you have all these tools that are available to you. I love the fact that even though I do fraud, which is my baby, I love my job. I love chasing paper because I don't have to talk to anybody. By the time I come to you, I already got it laid out. I've already did my due diligence by saying, looking at the data, looking at your claims. I probably sat outside your door and you didn't know it, but I've done my due diligence. I've done my homework. By the time I show up, I know your scheme. I just want to hear what you're going to tell me. And it's as you said, you might get some untruths. You might get some I didn't know. Or I've had cases which this lady, it was a DME. And what was happening was we had 719s. This was back in 2002, I believe. We had 719s which were for authorizations. And the nursing home would say, I need diapers, wipes, and chucks. That's all they would put on there. But this little old lady on oxygen felt the need to be the excellent billing expert. She would add expensive items that would make a $300 claim go to $1,000. So over time, imagine how much money she made for this company. Although we couldn't prosecute them criminally for what they did because it was a rogue employee, but again, it goes back, it's your responsibility, it's your company. So therefore, I don't know how this company didn't know they went from X amount of dollars to triple X amount of dollars. I don't know how they didn't know that. But the thing is, the responsibility is on the person who agreed to provide these services through Medicaid. She spoke about record retention. Make sure you're documenting. Make sure you're stressing that whomever is doing your records, you do them in a timely manner. You don't wait 5 days later. When I show up, you have that doctor party, because I had a case where that occurred, and it was through ink analysis that it was determined that he didn't do the records when he said he did the records. Or we have the case where the doctor saw patients 24 hours a day. Another thing about our office, we're healthcare oversight. That means I can show up at any time and ask you to provide me with access to records. I am HIPAA compliant. That means I can see any Medicaid patient's records. I can look, I can view, I can ask for a copy. But then understand my role. I'm the Medicaid fraud control unit. If you're a Medicaid provider, then you understand why I'm here. I'm here to do my job just as you're there to do your job. But one of the things we do, like I say, I believe in education. I'm with the Inspector General's office. We go out and we do trainings. We do help facilitate educating people about how to do it the best way, the right way. But that's what we've been doing all morning when we're educating the community. If you want to be a provider, I mean, I welcome it. I think it's admirable. But you got time? Okay, my time is up. I left some brochures and everything and cards out on the table. Please feel free to contact me at any time. Thank you.